My co-author, Leah Mueller, who's a lawyer from Germany, and I, Dr. Almas Bandeali, will be addressing the perfect storm of nursing crises we globally face with a quick fix recruitment strategies that indicates a need for policy reform. The agenda will be global stats on nursing shortage, recruitment trends, recommended implementations, and then if you have any questions, please direct them to my email. Thank you. Nurses are the building blocks of any healthcare organization. Nurses are the gatekeepers to patient engagement, spending more time with patients than any other healthcare worker, and patient experience satisfaction is highly dependent on these interactions. Let us discuss nurse shortage in terms of numbers from a global lens. Shortage, even before the Swan report, was to be 27.9 million, estimating 5.9 million nursing shortage globally. The report indicates 89% of nursing shortage is concentrated in low income and lower middle income WHO countries, Africa, Southeast Asia, and Eastern Mediterranean region. Globally, 17% nurses are expected to retire in the next 10 years, needing to educate and employ 4.7 million nurses to only maintain current workforce numbers without addressing the shortage. So in total, 10.6 million nurses will be needed by 2030, WHO reports a conservative number in their 2021 COVID-19 report that close to 116,000 healthcare workers have lost their lives to COVID-19. So a recent State of World's Nursing report highlighted that countries experiencing low densities of nurses are mostly located in the WHO African, Southeast Asia, and Eastern Mediterranean regions, and in parts of Latin America. And countries accounting for the larger shortages in numerical terms is in Bangladesh, India, Indonesia, Nigeria, and Pakistan, which is only to be worsened with population growth. And data for Organization for Economic Cooperation and Development, which is OECD countries, which is the graph to my right, and Eastern, Central, and Southern African region, which is the graph to my left, indicates that there are more nurses available per 1,000 inhabitants in the OECD countries versus ASCA. Additionally, the ASCA study highlighted by 2030, $4.7 billion would be required to train additional nurses to achieve the number needed in the 14 countries alone. Now, here is a global map of the number of nurses per 10,000 population. It shows similar mapping patterns of developed countries having increased nurses to the population ratio with developing countries. And around 81% of the world's nurses are found in American, European, and Western Pacific regions, which accounts for 51% world's population. The individual countries experiencing low densities of nurses are mostly in the African, Southeast Asian, and Eastern Mediterranean regions and parts of Latin America. Global inequalities in availability of nursing personnel are largely income driven, with a density of 9.1 nurses per 10,000 population in low income countries compared to 107.7% per 10,000 population in high income economies. So 107 nurses per 10,000 population in high-income economies versus 9.1 nurses per 10,000 in low-income countries. That's the disparity we are talking about. There are significant disparities within. So I'll quickly go over the nursing trends. And developing countries face high vacancy rates. About 30 to 55% in the public sector due to poor wages, remote locations, lack of amenities, and poor working conditions. Those are exactly the dangling carrots that are being offered by countries of opportunities to adjust the supply and demand disproportion. International policy actors will require to reinforce policies upon OECD countries that lure nurses from low income and lower middle income countries. My colleague, Ms. Mueller, will share the specifics on policy and implementation strategies. Thank you.
Yes, thank you. Hello, everyone. Also from me. To fully articulate a solution means to consider the gaps and shortfalls in the political, social, economic, and institutional realities on and through which this issue is constructed. For example, if we only consider nursing shortage as a problem of numbers, then the temporary fix will be producing more numbers of nurses. If the shortage is associated towards nurses being dissatisfied with their work environment, then improvements in their work environment resolves only that problem. Only addressing surface-specific problems in isolation is merely a short-term fix and will result in relapse. Upon the request of the 73rd World Health Assembly, WHO engaged with all WHO regions and updated global strategic directions for nursing and midwifery, SDNM for short, from 2016 to 2020 to SDNM 2021 until 2025, in resolution with the 74th WHA for nursing shortage policy action. Prioritization exercise was conducted with over 600 nursing and midwifery global leaders and renowned civil society stakeholders to identify most important policy actions, some of which we will share next. On the top on this slide, though, you can see some of the United Nations Sustainable Development Goals. Goal 3, good health and well-being, in addressing the global crisis of nurse shortage we face collectively. The recurrence of nursing shortage over time is perhaps a testament for a more beneficial analysis to address a complex issue, including many overlapping and interconnected problems from a global platform. Therefore, the policy priorities are interrelated. That is, the issue and policy responses in one are correlated with the issues and policy responses in the others. Also, there's a recommendation to incorporate these policies on domestic and international institutions. Let me explain what I mean. The strategic plan in education is for graduates to match or surpass health system demand and have requisite knowledge, competencies, and attitudes to meet national health priorities. The policies that need to be prioritized to meet this goal will require us to standardize domestic programs to meet national and/or international quality standards that align with population health. We will also need to increase institutional program capacity of participants and nursing professors. One way this can be done is by incorporating bridging programs for retired or about to retire nurses, for unfulfilled and new leadership and academic positions. Improving program capacity also means enhancing the quality of program delivery. For example, teaching concepts and skills that are relevant to practice, digitize education with technology, and stimulation labs to recruit students living in rural areas. One can see how prioritizing education policies also impacts the strategic decision of jobs, where the goal is to achieve retention of nurses in ethically sourced, sustainable positions. This can be done by educating employers and employees of WHO's mandate on global code of practice on the international recruitment of health personnel. Furthermore, jobs must be created methodically, which means forecasting the needs and trends of health-related labor markets. For example, evidence-based research highlights the need for integrating primary care practice in addressing the needs of population health in urban to rural settings. Countries also need to deliberately plan for gender-sensitive and neutral nursing workforce policies, taking into account that nursing workforce is still predominantly female. Policy considerations should also include enabling work environments for women, for example, through flexible and manageable working hours that accommodate the changing needs of nursing women. Therefore, policy priority is to attract, recruit, and retain nurses when they are most needed. Similarly, we address building leadership strategy by developing education programs that will support experienced nurses with bridging programs that desire to transition to academic and health-related governance positions. Now note in the service delivery strategic direction, the policy priority is to strengthen and standardize regulatory bodies. We have emphasis on this in education and job section as well. One can argue all of these requires funding. This problem was addressed in the International Council of Nurses Congress with the recommendation of countries to invest an extra approximately 1% of their GDP in their health workforce as part of a broader investment package to boost health system resilience by investing in strategic direction indicators we have shared here. I will end by handing over the last slide to be presented by Dr. Bandeali. Thank you.
Thank you, Leah. As my colleague pointed out, there's different platforms that need to be worked on from a policy level. And as advocated by international actors that influence nursing policies and practices, there's an overall need to invest in nursing education, jobs, leadership, and service delivery to meet the demand and maintain a steady ethical supply of nurses. And the word is ethical supply of nurses. And here are some of our recommendations. And we personally believe that if this need if financially we can sustain nurses in the developing countries, in the public sector, and remove this need of countries of opportunities where we can have passport without borders, we can have education without borders, and nursing license without borders, then I think we will be able to meet this gap where even nurses from the West can come to the East. We can learn from the West and from the East in this knowledge exchange. So with that, my colleague Leah and I and
presentation.
Thank you, Leah. Thank you. And if you have any questions, feel free to forward them to me. Cheers.